Hi, I'm Dr. Michelle with Glow Natural Wellness, and today we're going to talk about thyroid health in relation to the rest of your endocrine system. So many women start to get unsure if their symptoms that they're experiencing represent a thyroid problem or if those symptoms are sex hormone related. This is especially true for women who are in the perimenopausal and menopausal age range, and that makes a lot of sense for several reasons. So first, let's just kind of define perimenopause and menopause. So perimenopause is the 10 to 15 years leading up to menopause. This usually starts in the mid to late 30s to early 40s. And during this time, women notice an unpredictable rise and fall of their hormones and changes in their menstrual cycle, as well as a multitude of other symptoms that result from hormone imbalance. Now, a woman is considered to reach menopause when she has not had a menstrual cycle for a full year. This anniversary date of your last period, that one day, that is menopause. After your day of menopause, you're considered to be postmenopausal or no longer cycling. So that's a definition of perimenopause and menopause. But here's where it can get tricky. When women reach their mid-30s, which is the start of perimenopause, it's also when many autoimmune thyroid conditions start to present. And guess what? The symptoms of thyroid disease overlap overwhelmingly with perimenopausal symptoms. We see things like fatigue, brain fog, hair loss, weight gain, heat and cold resistance. So it can be really confusing for both patients and their doctors to sort out what is responsible for which symptom. And maybe both things are involved. Maybe we're dealing with a thyroid issue and a hormonal imbalance. So testing can also be really frustrating for patients in the conventional setting, because many times when we're looking at thyroid, conventional doctors will only offer a TSH test. That's the only test that they'll offer for thyroid testing. And TSH stands for thyroid stimulating hormone. It's a signal that the brain sends to the thyroid to say, like, hey, you need to make some thyroid hormone. And if your TSH is high, that suggests an underactive thyroid. The brain is working really hard to tell the thyroid that it really needs to get some more thyroid hormone out there. Now, the ranges that are acceptable for TSH are extremely wide by conventional medicine standards. I really believe this is quite a disservice for patients, and part of the reason why so many thyroid disorders go undiagnosed and why so many women are suffering. In fact, when a patient is trying to achieve pregnancy, the reference ranges are a little more narrow, almost half what the normal reference ranges are. So if someone's trying to get pregnant, we see in conventional medicine, they want TSH to be less than 2.5. Now, I believe that's a much more realistic marker of optimal health for everybody. So at Glow Natural Wellness, we don't just check TSH, we also check free T3, free T4, something called reverse T3, which acts like the brakes on thyroid activity. We also look for antibodies or the body's immune response against the thyroid gland. This allows for us to get a complete thyroid test. And we look at the results from a functional perspective. We compare your results against what is optimal, what is the ideal level of thyroid hormone, not just what is common or considered to be okay by conventional standards. And this is so important. This is why so many women say that they have a thyroid test and it's normal, and they in fact have thyroid dysfunction. So you might be wondering, if thyroid dysfunction is detected, are you stuck taking medication for the rest of your life? Well, the answer is not always, hopefully not. Many times we can address and treat nutrient deficiencies such as zinc, selenium, vitamin D, and iron and iodine, and we can correct these deficiencies to help the thyroid heal itself. Also, lowering the toxic load is a huge needle mover for improving thyroid function and reducing autoimmunity. Diet is another important area where we can improve thyroid function without any medication. In fact, 80% of people who have autoimmune thyroid disease, their thyroid function can improve by just removing inflammatory foods like gluten, dairy, corn, soy, and industrial seed oils. So using food as medicine is a super important thing to do, especially when addressing thyroid health, as well as really all forms of health in a holistic practice. So there is food, there's supplements, there's toxicity, but there's so much to treating thyroid conditions. It's more than just what you put on your plate. It's more than just the supplements you take. So I hope you enjoy it. Thanks for watching, and I'll see you in the next video. Bye for now.